is suitable for general family viewing.
Now we are approaching the festivities, and of course, when we are all in this merry and excitement of the holidays, it's important to also look into the eating disorders that may be a factor in our society right now. And joining the conversation is Dr. Lydia Mose, a familiar face. Karibu sana.
Thank you.
Yeah. So maybe you can just do a brief introduction.
Thank you for having me. My name is Dr. Lydia Mose. I'm a medical doctor by profession, general practitioner. I work with Meridian Medical Center at the Yaya branch in Kilimani, and I'm happy to be here today.
Yeah, I'm happy to meet you as well. So the conversation today is going to be something really sensitive, and I think most people, and this probably affects many age groups, I would say, from watoto, adults, and even the elderly. But most importantly, let's get to understand, what would you say is an eating disorder?
Thank you. So eating disorders basically are a group of conditions, a set of conditions, medical conditions, mostly mental conditions, that lead to persistent, abnormal, deviant eating behaviors that generally obviously will affect a person's mental health, their physical health, of course, and generally they lower their quality of life.
Right.
Yes, those are eating disorders in a nutshell.
Okay.
Yes.
And today we'll be looking at anorexia, bulimia, and also binge eating. So maybe let's just do a breakdown of the definitions, starting with anorexia.
Yes. So anorexia nervosa and bulimia nervosa, most of the time they are interchanged because they are similar in a lot of ways. But of importance to note is that with anorexia, a person will have a BMI of less than 17.5. BMI is body mass index. I'm sure you've heard about it.
Yes.
So usually with a normal person, your BMI, your body mass index, is supposed to be between 18 to 24. Right. So when you have a body mass index of less than 18, you're classified as underweight. If you have a BMI of above 24, you're classified as overweight. Okay. So with anorexia, you'll have people having symptoms that we'll discuss later, but basically they have a BMI of less than 17.5, so they're severely underweight. With bulimia, the BMI will be either between 18 to 24, which is normal, or even overweight, and binge eating we'll discuss later. So with anorexia nervosa, you get cases whereby someone is abnormally preoccupied with how they look. They're preoccupied with their body weight, their body shape. They have abnormal eating behaviors whereby they restrict themselves from eating so as not to become fat, so to speak. They can engage in destructive behaviors, which we will discuss later on. With bulimia nervosa, we have patient indulging in what we call binging and purging. So binging is excessive overindulgence in something. In this case, because it's eating disorders, they overindulge in eating. That's what we call the binging, like binge eating. And then after that, they get an overwhelming sense of guilt or shame or feeling depressed about what they've done. So they engage in now what we call purging. So purging is getting rid of unwanted substances in an unhealthy way. So in this case, what they've eaten, they either vomit or use other methods that we will discuss to get rid of it. So for binge eating now, as the name suggests, they eat a lot. They just eat anything. But now, unlike anorexia and bulimia, they're not careful about how they look or their body shape or how they perceive themselves. They just eat for the fun of it, just to engage in binge eating. Okay. Yeah, so in a nutshell, yes.
So you've mentioned the whole binge eating being, having a very close correlation with bulimia. But can you have a case of bulimia even when the binge eating is not maybe involved? Say, for example, one who is an anorexic patient, say, for example, most of the time they're trying to avoid eating because they don't want to get fat and stuff like that. What if sometimes you're under supervision, maybe your parent is watching, say your teachers, so can you get a case whereby now this anorexic person decides that I'm going to eat so that I impress them, but later on falling back now to the the purging? So have you had such cases?
Yes, you can have, although as we'll discuss later, among the signs and symptoms, one of the key signs and symptoms is someone who hides to go and eat. either they eat with you, maybe you're at the family table, you're eating, then they'll excuse themselves to go to the toilet, to go now do the vomiting and the inducing themselves to get rid of whatever they've eaten. Or someone who doesn't like eating in front of people. So you can be under supervision. Of course, they'll do that to impress you and for maybe the parents to see, okay, they're eating, so that they don't get reprimanded. But later on, they go and get rid of whatever they've eaten. Yes.
Okay. So since we've kind of mentioned on the signs and symptoms, maybe we can dive deep into it and understand what are the very first signs, what parents could look out for.
Yes. So I'll talk about all three of them generally. So you'll have a child. I'll use the word child a lot because with these eating disorders, mostly they develop in teenagehood or young adulthood, and also of importance to note is that they happen mostly in females. It's hard to get a male who has an eating disorder. It mostly happens in females, young females in their teenagehood years or in their young adulthood years. So with the signs and symptoms, you'll find someone who skips meals altogether. Mostly for anorexic patients, they skip meals because they're preoccupied with this intense fear of adding weight, so they just don't want to eat because they fear they'll add weight. So they skip meals. So if you see someone skipping meals, that's a very important sign or symptom. Then you'll have patients who, as we've said, they hide. Maybe you're at the dinner table, you're eating, then they excuse themselves to go to the toilet or to go somewhere else. They go and hide and now engage in that purging behavior, whereby they go and induce vomiting. They go and maybe take those alternative kind of medications or laxatives to speed up bowel movements so that they can remove whatever they've eaten. Some even use diuretics to now get out like the excessive fluid they've gotten. You will find someone who engages in excessive exercise. So someone who like overgoes to the gym, they're always at the gym, they're always running, they're always working out in the house, so they do it in excess. There are certain limits to working out. So you find someone who's exercising excessively in a bid to lose weight. Then you'll find someone who is excessively preoccupied with talking about how they look, especially for anorexic patients. They're always talking about, I want to lose weight, oh, I look fat, I'm obese. They're always in front of the mirror looking at themselves and negatively criticizing themselves and saying, I look fat and such like things. And generally, you find such people eventually, they withdraw socially from people. These behaviors, because most of the time, as we'll learn later on, they are associated with other mental disorders as well, like depression, anxiety, obsessive compulsive disorder. So with time, they withdraw themselves from social interactions. They become socially deviant. They don't want to stay around people. Maybe if it's a child at school, their academics will suffer. They'll get into substance abuse and such like things. And of course, now for physical symptoms to watch out for, you'll get patients forming things we call calluses on the knuckles of their hands. Because of that habit of inducing vomiting, they have to like insert their hands in their mouths. So you'll find that biting or that friction with the teeth. So you'll find the calluses on the knuckles of the hands. Then you'll find patients with eroded enamel of the teeth, because of that inducing of the vomiting, that reflux and gagging coming out with the acid in the stomach. So it will erode the enamel of the teeth with time as you go on, and even cause things like tooth decay, things like those ones. And then also like for anorexic patients, because of they don't eat, so they don't get the nutritional benefits that come with eating. You'll find they suffer a lot of bone deformities. They suffer from things like osteoporosis. Their bones weaken. Like you can just see someone who has like weak bones because they don't get the nutrients. Like we talk about calcium. Calcium you have to eat in your diet to get it. Like vitamin D that you can get in your diet, they lack those ones. So they have extremely brittle or weak bones. So we have hormonal, when you eat properly, the nutrients that you get, there are some diseases that come because of hormonal imbalance. So anorexic patients, when they don't eat properly, there are some hormonal pathways that get interfered with. So you find that these patients miss their menses. Those hormonal pathways that are involved in regularizing and making sure your menses come, they are interfered with. So you get these patients have missed their menses totally. Yeah, so those are some of the signs and symptoms that you look out for generally to pick that someone has an eating disorder.
Okay, so now that we've been able to, have an insight on the signs and symptoms, I think it's best if we dive deep into now understanding what are some of the predisposing factors that may lead one to have, generally these eating disorders.
Okay, so top of the list is genetics. There are people who are just genetically predisposed to having eating disorders in their lives. And then the second one is psychosocial and emotional factors, as we were discussing earlier. Stress. So there's some people who have maybe, like since it's people with in a young age group who get the eating disorders, you find maybe a young girl who has a negative self-image or low self-esteem, so they engage in a lot of eating, or maybe they have people in their lives who are not like reinforcing a positive body image of them. They're telling them, you're fat, you're looking funny, so they have to compensate and get like the ideal image. And like social media is nowadays, social media is all over the place, and telling people you have to look a certain way to be beautiful or to be the ideal person. So such things also contribute. And also, as I've mentioned earlier, there are some mental disorders that coexist with the eating disorders. So you find people with depression, most of them will also most likely have an eating disorder as well. People who have perfectionism, they have what we call OCD, obsessive compulsive disorder. They're perfectionists. They have to look a certain way to feel validated. Right. So and people with anxiety disorders, so psychosocial, psychological problems also predispose people to eating disorders. And last but not least, stress, as I've said. So generally with the day-to-day activities of life, people venture into binge eating. You've had people who stress eat. If you're stressed, you just go and let out your stress on food and eat a lot. So binge eating, most of the people with binge eating disorder have stress as a predisposing factor.
Okay. Wow, that's amazing, because I think now we get to understand why sometimes you may get it's not in your genetics at all, but now you get a child is just, exhibiting such symptoms. And I think it's really, really bad, because at the end of the day, they're still young, most of them, and they wouldn't even know what they're doing to their body. And they wouldn't even understand what complications come with it. But that means we will be definitely diving deep into understanding the complications of the situation. But we'll be doing that, of course, right after the break. So please do not go far.
You are watching TV47, the home of untold stories.
Je, maumivu ya kichwa na kukosesha amani? Kaluma Strong hutuliza maumivu ya kichwa, maumivu ya mwili na hata huondoa joto jingi mwilini. Kaluma Strong ina aspirin kama kiungo. Maumivu yakizidi, muone daktari.
Chachisha mechi. Chachisha Mechi. Catch all the 64 games live from Qatar on GOtv Super. Get your GOtv decoder for only 1,999 Kenya shillings. GOtv. Love it.
Hey!
Kaluma King Herbal Lozenges zinazo nguvu maradufu kutuliza kikohozi, vidonda vya koo na mafua. Kaluma King ni shwari.
Tika mama huyo muharifu kaiba kuku zangu, vifaranga wangu na mayai zote pia kabeba. Aya, tika mama huyo.
Maumivu yakizidi, muone daktari.
You are watching TV47, the home of untold stories.
Welcome back to BTL. Well, as you know, when we have these festivities, it's all food everywhere, but we really need to look into the eating disorders. And of course, we are having a wonderful conversation with Lydia here. And of course, earlier on, we touched on the symptoms, we look at the predisposing factors as well. But it's best to also understand now when it comes to the complications associated with these eating disorders, because sometimes we have one goal, people who are anorexic, bulimic, they have one goal. Maybe they want to lose weight, maybe they want to just get rid of their stress. But in the midst of doing that, what can that maybe expose them to, the complications associated with those eating disorders?
Yeah, thank you. So key among them, as we've said, if you're eating, you're binging and purging all the time, you're missing meals, you're skipping meals, you're going to miss nutrients. And key among them is what we've said: calcium, vitamin D. So, and because it happens at a younger age, you'll have problems with growth development. So you'll find that these patients or these young ladies will have a problem with growth and development because they are missing the essential nutrients and minerals that are needed for them to grow into good, healthy adults. Yeah, and then you'll have things like because it comes with mental disorders as well. So they also, some of them also delve into substance abuse. They become like alcoholics. They start using drugs like marijuana and what have you. So you get most of them dive into substance abuse.
Right.
Of course, we have things like depression. Now it can come, the eating disorder comes first, then they fall into depression, they get anxiety disorders because they don't feel confident in who they are, or they get the obsessive compulsive disorder. They also get suicidal thoughts, because once you get depression, it can become a downward spiral. You start having suicidal thoughts and ideations, and some even actually commit suicide, as you've seen like in countries abroad. We also have withdrawal from social interactions, as we said earlier. They don't feel confident in their body image, in their weight and their shape, so they prefer to withdraw altogether and not interact with people. So this actually affects their schoolwork because they are of school going age. Some abscond from going to school. They don't go to school. Some don't go to work. The young women, they don't go to work, so it affects their lives in that way. And we also have, it also affects the family. We can't ignore that fact. Because if you have someone who has that disorder, it will affect you as a parent, as a sibling, or if it's if you're the son or daughter to whoever is having that problem, it will also affect you as a family. So those are some of the complications that we get.
Right. And maybe just now to understand on the treatment side of it, the diagnosis, at what point is it necessary for one to get that diagnosis done, and how does the treatment process look like?
So when you notice any of the signs and symptoms that we talked about earlier, someone skipping meals, someone hiding from you when they're eating, they go to purge in the toilet, someone having those physical symptoms that we talk about, then that is essential at that point to take them to a doctor to be evaluated. Yes. In terms of treatment for eating disorders, it's a multidisciplinary approach. It's not a one-man show. It's not one doctor who can handle such a patient. It's a multidisciplinary kind of approach where we have the primary care provider, the general practitioners, and of course now the psychiatrists come in because it's a mental disorder. And then also key, very important, because it's an eating disorder, so nutritionists have to come in, dietitians have to come in to manage that disorder. So basically it involves nutrition education by the nutritionists and the dietitians to give this person the education about what they need to eat and the complications that will be there if they don't eat certain essential foods. So we have that nutrition education. We have psychotherapy. Psychotherapy comes in whereby they have other coexisting mental disorders, like the depression, the anxiety that we talked about. We have things called family-based therapy. That one will not delve into it. It's a topic on its own, whereby basically the family comes in to give support to this patient, just making sure whatever the doctor said, whatever the nutritionist said, they are adhering to the treatment and they're going on well. We have things like cognitive behavioral therapy. All that is under psychotherapy. Yeah, and then we have now the actual medications. Of course, there's no cure for eating disorders. It's just medicines that kind of help you to control the urge to want to eat or to want to purge, things like those ones. So it's basically those three: nutritional education, the psychotherapy, and now the medicine.
And what about the mental side of it, you know, for the victim, or rather the patient themselves? How should their mind, you know, basically mentally, generally, in a bid to kind of control or rather curb the effects that come with these eating disorders?
Of course, they can't do it alone. You can't say, I have an eating disorder, so I'm going to lock myself in my room and give myself therapy and get through this mentally. So that's where the mental specialist comes in. The psychiatrists, they come in and give them what we've talked about, the psychotherapy. They involve the families, the family-based therapy, the cognitive behavioral therapy, whereby you're taught to understand your own actions, why you're doing what you're doing, and the moods that you're having, and basically having the ability to control it. So it's not something that you can deal with alone as a patient with an eating disorder. You have to really involve those three key areas: the primary care provider, the psychiatrist, and the nutritionist. But it's a mental health disorder, so the psychiatrist is really key here to guide you and give you the therapies that you need.
But I do understand, if at all, you know, the person themselves are not willing to really go through all that, because you've mentioned that it involves a whole lot of people, and sometimes, you know, things to do with body image, it can be really conflicting, because you're talking to me from your perspective, you're comfortable with how you look, but what about me? Do you understand that? So I believe that having all these people coming together, it's all to make sure that this particular patient has now gotten to the point where they now understand how significant a recovery will be, even for themselves, their health, and all that, and also even adapt, you know, ways of losing weight in a healthy way, eating right. So I do understand that. And maybe we've mentioned about, you know, parents and how they can also be part of it. So maybe just to elaborate on it further, on how parents can best deal with it, because I understand sometimes the age can be even from 10 years, sometimes 7, 6, depending on, you know, the pressure, the peer pressure around that particular individual. But how best can parents approach this particular thing?
So it needs a lot of emotional intelligence to handle these patients, because, as you said, they are in their fragile years, in their teens, and you know, a lot is happening when someone is in their teenage years. They are rebellious, they're undergoing a lot of changes in their bodies emotionally. So you need a lot of emotional intelligence to handle this kind of patient. So as a parent, number one, what we encourage parents: don't diet yourself in front of the child. If you're on a diet, or you for some reason you want to lose weight, or you want to get some kind of body shape or image, we encourage parents not to do it in front of the child, because at that age, you know, they imitate a lot. What you do, they copy a lot what you do. So you can't tell a child, don't do this, and you're also doing it. So if you have to diet, do it at your own time. Don't do it in front of the child, so that at least they know the benefits of like having all the meals and getting proper nutritional balance. And then also talk to your child, because at that age and in this era that we're living in, they have access to the internet a lot. So they read a lot about those disorders, they read a lot about body image and the ideal weight that they're supposed to have. So it's important as a parent, you be close to your child, talk to them. You know, maybe what are you reading in the internet, what is it saying, or why are you behaving like this, why are you always in front of the mirror, why are you always worried about how you're looking, why do you have this fear of eating? So talk to them, and those misconceptions that are there in the internet, just correct those misconceptions and help them know the importance of having a healthy and a balanced diet and eating. And also, as parents, it's very important to be the positive reinforcer to your child. You know, be supportive, be their cheerleader. You know, help them to reinforce a healthy body image, help them to know that they are beautiful the way they are, whatever shape, how much they weigh, you know, they are healthy and they are beautiful the way they are. You know, at that age, what you say can really make or break a child. So it's good for parents to be making them, not breaking the child. Tell them they're beautiful, reassure them, so that at least they know that they need to be healthy. So those are some of the things generally that we need to do. And of course, I always say, make your doctor your friend. Always involve a doctor. Have a doctor on standby that you can call in case things get out of hand, and tell them to at least help you and take you through the journey with your child. Yes.
Yeah, and maybe as we wind up, when we look at the whole spectrum of the whole eating disorders, and maybe even with your experience with the different patients that you've had, how has the impact been, once they're on a medication and once now they've come forward, sought that help? How do the recoveries look like?
Of course, the recovery is gradual. It's not immediate thing, like you come in for therapy today, tomorrow you're good.
Yes.
It's a gradual process, of course. As I said, the emotional intelligence, even of the doctor, of the nutritionist that is handling the child. But basically, most of them recover well. They accept. Once you take them through that process, you ask the questions like, why are you doing what you're doing? Most of the time they have a background to it. So if you get to understand and they get to talk about it and really say what it is that is causing them to behave this way, and get to understand their disorder and accept it, they also need to accept. You can't treat someone who is in denial and does not acknowledge that they have the eating disorder. So once they get to accept, the recovery is gradual, but it's successful most of the time. Yeah, it's possible to recover.
All right, so that means there's definitely hope, and if parents can really understand this whole perspective and know that we have this African culture. Ukiona mtoto akulu unamtandika, kula hiyo chakula, unailazimisha kwa mdomo yake mpaka venye. So I think sometimes the African culture, we can't blame our parents. I mean, that's just how it is. But I believe with this interview and with this conversation we've had today, I mentioned to you that I relate personally with it as well. So I believe that parents can now change their perspective when they feel that, mtoto wangu kidogo, inaona ni kama mambo yako sawa when it comes to eating, then they have to try and understand them, be that reinforcer that they need. Yeah. Absolutely. Yeah, and I'm really glad we've had that conversation. But maybe as we now finish up, what advice can you give to parents, to one who is probably going through that right now, the whole eating disorders? What would you say to them?
I'd like to tell them they're not alone. If they themselves are going through the problem, or they have a child going through the problem, they don't have to suffer alone. They don't have to isolate themselves. It's not a life sentence. They can seek out other parents who have children going through the same thing, or other patients going through the same thing. They can have like a small community of people with the disorder, so they can share ideas, and how, like the ones who've overcome, they can tell them how they were able to overcome, and that way they can help each other.
Yeah, and we are lucky because now we have people like you who can really see it as an issue that needs to be addressed, rather than kitu ya kuchapa mtoto about. It's something that needs to be addressed because it's all mental. But thank you very much, Dr. Lydia, for sharing this wonderful conversation. It has been an eye